according to the website, people who turn 75 this year are not eligible for the vaccine or to call for their appointment until Thursday. But we are hearing that people who are 74, 75 are already getting appointments. Apparently, it's all the talk among seniors that you can call now and get an appointment before you technically qualify. Is that true? And if so, isn't that a little confusing if what you guys are advertising isn't actually true?
You know what? We are trying to be as efficient as we can. So yes, in many cases, if it's a couple and there's somebody who's in that age and somebody who's within, a very short eligibility period, some places are able to do that. And if there's appointments available, we're moving them up. So yes, we're seeing that it's working. People are being very respectful of this, which is great. It means that things up in certain areas more than the nature of the population and what people are dealing with.
For those that are 75 or 76 who are fortunate enough to get an appointment, can you explain first off how that happens? I want to talk specifically, I know you'll say that there's different regions. I want to talk specifically about Fraser Health. That in Fraser Health, we know that there are some 75 and 76-year-olds who got vaccination appointments before it was their scheduled timeline. So how did that even happen? Is there an assurance that it will no longer happen? Or what does this say to sort of opening up for those in Fraser Health when they can actually get their vaccine?
Why would we stop something that moves people up? This is happening very rarely. Yes, it happens. Maybe somebody is over the age of 70 and their partner, and you know what? If there's appointments available, we want to fill them. This is not a big conspiracy or anything evil, okay? Most people are doing the right thing. It means that the situation is smooth. The time that people are online is limited. They're getting their appointments. The appointments are very efficient, and we're tracking the appointments to match the vaccine that we have. So there are slight differences in different parts of the province, as we know, until we move to our seamless system. But this is not something that's happening a lot. This is something that occasionally happens, and it's a good thing. It means that more people are moving up the line. But we're not seeing, there have been some occasions where people have, who are not even in their 70s, for example, have tried to book appointments and their appointments are cancelled, or if they arrive at a clinic, they're told that they're not eligible. So we have systems in place. Most people are following the rules, and we are very grateful for that. That means it's a smooth experience for everybody. I don't know if you want to say anything about it.
I think I think overwhelmingly people are following the rules, Richard, and we've had 540,000 shots delivered, and when people call up, they provide their date of birth and they say they're in the cohort, and they need to provide their personal health number and other information, and then they receive an appointment. And there have been a number of cases, of course, when appointments have been canceled, when people have been outside of that, or they're misinformed, or whatever. But that's a lot of immunizations, and right now about 10.5% of the population immunized, about 80% of those over 90 immunized. So to date, it's been working. We've been able to assure that in our age-based effort that we're moving through age cohorts, and I think you can see that happening every day. And I think there'll be a dramatically lower desire of anyone to want to try and move up when they see the progress that we're making day by day, down the 79, then today 78, and 77, and so on through the cohorts. And on Saturday, for example, 33,000 people booked their appointments on a Saturday. That was when we opened up to people age 79. So there may be some exceptions to that. We're asking people to follow what we're doing, because that means it's fair for everybody. And I think overwhelmingly that's the case. I'm sure there'll be some cases where people may get it a few days before they would otherwise have got it. And as Dr. Henry has said, that's not the end of the world.
Richard, do you have a follow-up?
I do. I wasn't suggesting there was a conspiracy theory, but you keep saying a majority of people are following the rules. So is the rule that you can only call in on your birth year? And if you don't call in your birth year, how is it possible that people get appointments? Like I think there is some, and maybe this is happening to very few people, but there still seems to be confusion. And if you're a 75-year-old in Fraser Health, if you call right now to get your appointment, what should you be told?
Yeah, we have an age base, and we've tried to gate it by year, as you say. But I will remind you what we've been saying all along. You don't always know another person's story. There are other reasons why people may have got appointments. We have been talking about people who are clinically extremely vulnerable, and how we've been reaching out to some of those categories as well. And the vast majority of people are doing what we've asked them to do, and that means that it's efficient for everybody.
The end of the day for some of these clinics, I'm wondering if there's any kind of process that people are expected to use for sort of using up the last doses at the end of the day, if maybe they've gone through appointments. We've been hearing some sort of anecdotal reports that, people have yelled across the street, I don't know how true these are, that, we have a few doses left. Is there any sort of procedure that is supposed to happen for, the circumstance where there are doses left at the end of the day and people have gone through their appointments? Or is there a list of people who are supposed to be coming in the next day who can be quickly called? How does that work?
There's all of that, yes. We've been watching that very carefully, particularly with the vaccines that have a 6-hour window that you need to use them, so Pfizer in particular. And yes, we have all of that. There's lists, there's pulling people in sooner for their appointments if we're getting to, and it's also how we manage the clinic, and that's one of the reasons why we're using the mass clinics that we have, because we can be very efficient in how we're using the vaccine. So who's drawing it up, making sure we get every 6 doses or more from each vial, making sure that we have just enough drawn up and out of the freezer so that it meets the needs of the patients as there are the people who are going to be immunized as they're coming through. And we have a plan for what to do at the end of the day. In some parts of the province, that means that all of the extra doses are taken to the local emergency department. It means that sometimes if there's extra doses, people are called in early, or other people are on the priority list. So there's no point hanging out inside of a clinic, because all of the doses at the end of the day are spoken for, and we've been really, really good. We look at wastage in all of our immunization programs, and this is one thing that was seized us quite early on in this, particularly when we were having very limited supplies. And so we have measures in place to protect against wastage in all stages of how we plan the clinics, how the doses are drawn up, how many vials are thawed at a time, etc. So yeah, there is a very detailed plan, and it varies by where the immunization is happening. But so far we've done really well at not wasting doses and at getting maximum doses from every vial.